Welcome to the Bedside Clinical Skills Student Orientation. I am Alif Yusabe. I'm the content lead for this course. First, I want to start by declaring that I have no conflicts of interest. So many of you are probably wondering, what is Bedside Clinical Skills? So BCS is a course that's designed to give you the opportunity to practice bedside clinical skills on real hospitalized patients before entering your clerkships. During this course, you're going to learn the structure and organization for presenting patient information in an oral and written format. You're going to practice interacting with patients in a sensitive and respectful manner, and you'll gain experience with discussing actual cases and receiving faculty feedback. So this course has several objectives. By the end of the year, you will be able to perform a full history on a hospitalized patient. You will be able to conduct a full adult physical exam. You'll be able to document a history and physical on a hospitalized patient with particular attention to the appropriate organization of this material. You'll be able to differentiate between subjective and objective findings. You will learn that subjective information will go in the history sections, whereas objective information will be documented in the physical exam section of the H&P. You'll be able to identify and appropriately rank patient problems into a problem list. You will be able to develop a differential diagnosis and discuss this within your assessment. You will formulate a plan, and this will be appropriate to your level of learning. And lastly, you'll be able to deliver a concise and well-organized 5-minute presentation. The course is designed in a small group format. This will allow for group discussion, peer feedback, and hopefully bedside rounds where your faculty will show you interesting and admirable physical exam findings. Each student must attend 4 sessions. There is 2 sessions in the fall and 2 in the spring. Students requiring remediation will be expected to attend additional sessions. Each session is about 3 to 3.5 hours long. Before your first BCS session, please review all the following materials. You can find all of these in Entrada. Before each subsequent BCS session, you're responsible for reviewing the grading rubric with the scores and comments, as well as your H&Ps with your preceptors, edits, and comments. You can find all of these on Blackboard. Please refer to your syllabus for how to review grades and comments under the heading after each session. So what happens during each BCS session? So first, you're going to meet your preceptor at the designated location. If you're assigned to the general medical floor, please meet your preceptor at Obampan. If you're assigned to the emergency department, you will meet your preceptor in the designated conference room. You can find these assignments on Entrada. Next, your preceptor will assign patients. You're going to have about 5 to 10 minutes to review your patient's history and medication list in Epic. You are only going to use Epic to review their past medical history, their surgical history, and their medications. Do not look up their family history, social history, or allergies. Next, your preceptor will introduce you to your patient and familiarize you with the room.
All right, Dick, let's meet your patient.
Okay.
Hello? Mr. Tran, can we come in? Hi, sir. So I turned on your TV real quick, okay? Mr. Tran, this is Derek. He's our second-year medical student. He's me talking to you today. I'm just going to show him around the room really quickly.
Okay.
So I pushed mute on this TV. It's also the patient's call light. If the patient or you needs anything, you're able to push this big red button to call a nurse.
Okay.
Okay, so you can see right now he's on the monitor. This blue wave is the patient's pulse ox. This blue number underneath is his pulse, his heart rate. He's not on the monitor right now. It's picking up the pulse oximeter heart rate. And then this number in purple is his blood pressure. To operate the electronic blood pressure cuff, you'll see a start button. All you need to do is hit that button start, and it'll start taking his blood pressure. Okay? And then back here you have the machine to take his temperature. the probe comes out. There's covers here right behind it. You're going to slip a cover on. It's going to go underneath his tongue, and then you'll see the machine. It'll start kind of spinning to give you a number. It'll beep. That's the temperature, and then you just push this button to discard the top. If you need a otoscope, we have that, ophthalmoscope, and then let me show you where the covers are. 2, 2, 4, 4. You're gonna hear a little click. You're gonna unclick the button here. Squeeze these two together to open the door, and then you're gonna pull this top open. In the top, you'll find otoscope covers. If you need tongue depressor, will be in here too. Okay. So to bring the patient's rails down, you're gonna click this yellow lever up. Then the rail goes down. To bring it back up, all you need to do is push it up. Okay. So down, and then if you want to lay the patient down, yellow lever up, and then it's going to release the top of the bed, and you can lay the patient down. Same with if you want to bring him back up, pull it up again, bring him back up. Okay?
Students will then have 60 minutes to perform their history and physical. Begin the encounter by reintroducing yourself and your level of training. Reiterate to them that you are not part of the care team and that this is solely an educational experience. Sit down next to your patient at their eye level, and remember to always explain what you are doing.
Hello, Mr. Tran. My name is Derek. I'm a second-year medical student here at Rush. Thank you very much for agreeing to help me learn how to take a patient history and do physical exam. I just want to remind you that even though I'm going to be asking you a bunch of questions today, I'm not actually a part of your patient care team. If you have any questions about your patient care, though, I am more than happy to help find someone who can assist you. You mind if I take a seat? Sure. Alright, now before we begin, I'd like to quickly go over a little bit of exactly what we're going to be doing today. First, I'm going to be asking you why you're here, and then I'm going to ask you a bunch of questions about your past medical history. And then we'll move on to sort of a physical exam portion. I just want to let you know that everything you tell me today is completely confidential, so there's no need to worry about that. But if you ever have any questions throughout, just let me know. Do you have any questions now?
Start obtaining your patient's history using open-ended questions. Follow up using directed clarifying questions. Sometimes patients will have more than one chief complaint. If they do, you must perform an HPI on each chief complaint.
Okay then, let's get started, Mr. Tran. So what brought you to the hospital today?
Well, my right arm's been hurting for 3 days.
Okay. Can you describe the pain a little bit? What type of pain are you having?
It's burning.
For past medical and surgical histories, you will be reviewing with the patient the information you found in EPIC. If the patient does not know their history, ask them if they brought a list. If there are family members or friends in the room, ask the patient if you can ask them for this information. And lastly, if they don't know all or parts of their history, please document this.
Now I want to review a little bit more about your past medical history, if that's all right. I see here you have a history of diabetes that was diagnosed in 2014, congestive heart failure that was diagnosed in 2009, and you've had a high blood pressure, hypertension, since 2002. Is this correct?
Yes.
Okay. And you have had surgery in the past. I see here you had an appendectomy in 1988. Is that correct? Anything else?
I did have a recent mole removed 2 weeks ago from my arm.
Okay.
Same goes for medications. Again, you're going to review the information you found in EPIC with the patient. You will need the name of the medication, the dose, the route, and the regimen. If they don't know, ask them if they brought their medications or a list. You can also, again, ask other people in the room, such as family or friends. Again, if they don't know all or parts of their medication list, please document it.
All right, Mr. Tran, now I'd like to review some of your medications with you. I have here that you're taking a couple different medications. Are you still taking metformin, 500 milligrams twice a day, Lasix, 20 milligrams twice a day, lisinopril, 20 milligrams once a day, and metoprolol XL, 100 milligrams once a day?
Let me check. All that's correct, except my Lasix was recently increased to 40.
Okay. And who did that for you?
My primary care doctor.
When obtaining a social history, remember that you'll be asking sensitive questions. Begin by reminding the patient that everything that they tell you is confidential. If there are friends or family in the room, please ask them to step out before asking any social questions.
Okay, Mr. Tran. Now I'm going to ask you a couple more sensitive questions. I don't want you to be alarmed. These are questions we ask everybody, but I just want to warn you in advance, okay? Again, everything that you tell me is completely confidential. So my first question to you is, do you use any tobacco products?
When asking the review of systems, remember that this is actually a review of the patient's recent symptoms, not diagnoses. Do not ask every single symptom for each organ system. Pick 3 or 4 symptoms per organ system based on your patient's chief complaint. It's okay to ask more symptoms in the organ system related to the patient's chief complaint. Begin by explaining to the patient that you'll be asking them a lot of different questions regarding recent symptoms. Ask them to tell you if they've experienced any of these symptoms recently with a simple yes or no. Here's an example of a correct review of systems.
Okay, Mr. Tran. Now I'm going to ask you a lot of questions really quickly. It's something we call the review of systems. So I want you to respond yes or no when I ask you all these questions if you've had any of these symptoms in the past 3 months, okay? So my first series of questions, have you had any cough, wheezing, or shortness of breath?
Now let's move on to the exam. Start by washing your hands. Next, get a full set of vital signs. Before each part of the exam, explain to the patient what you will be doing before performing the action.
I'd like to move on to a physical exam at this point, so the first thing I'm going to do is wash my hands, okay? So the first thing I'd like to do, Mr. Tran, is take your vital signs. So let's start with your blood pressure, okay? So I just need to borrow your left arm again, okay? And I'll place this blood pressure cuff on you. How's that? Is that comfortable?
Yes.
Okay. And then let me just start it here.
Do pertinent exams first. If the patient's chief complaint is abdominal pain, do the abdominal exam first. Many parts of the exam are performed on bare skin. Always warn the patient before uncovering them. If you need a patient to move, explain to them that they need to move for part of the exam and why. It may be difficult for a patient to move on their own. If you need assistance, please look for a nurse or other staff member, and if you can't find one, please call your preceptor.
Okay, Mr. Tran, for this next part of the physical exam, I need to listen to the back of your lungs. Now, I know you're in pain, and it might be a little bit hard, but this is the most accurate way to perform a lung exam. It'll be very quick, and then as soon as I'm done, I'll help you get comfortable again, okay? All right, so I'll grab my stethoscope. And then I'll have you sit up a little bit, okay? And just take deep breaths.
When performing the abdominal exam, remember to cover the patient with a sheet before lifting their gown. Also remember the order in which the abdominal exam is performed. First you look, then you listen, and lastly you feel. This exam should also be documented in this way. If you find tenderness on the patient's abdominal exam, remember to determine whether or not there is guarding and rebound.
All right, Mr. Tran, the next thing I'd like to do is an abdominal exam. For this part of the exam, I'm going to have to lay you back in the bed so that you're lying flat. But don't worry, I'm going to keep you covered with the sheet while I expose your abdomen so I can take a look at it, okay? Okay. All right, so the first thing I'll do is take the sheet and make sure we keep you covered. Right. There's half of it. And the other half. And now I'm going to lean the back of the bed down, okay? Still comfortable? Yeah. Okay, if you could pull up your gown for me while I keep you covered with the sheet. All right, thank you very much. Do you mind if I move some of your pants here out of the way? There we go. Now the first thing I'm doing is just taking a look at your abdomen. I'm inspecting it to make sure that everything looks all right, and it does to me. So the next thing I'm going to do is auscultate or listen with my stethoscope again, okay? And everything sounds healthy and normal as well. All right, for this next part of the exam, I'm going to actually press on different parts of your belly, those same spots I listened to with my stethoscope. You let me know if you have any pain, okay? I'm going to start up here on the right. Any pain there?
No.
What about if I move over to this side? Any pain there?
No.
How about here?
Ouch.
Oh, I'm sorry, very sorry. So that hurt you when I pressed in that left slower side there?
Yeah.
I'm going to do one more thing, and I know it's painful, but I'd like you to let me know if it hurts more when I'm pressing or when I take off the pressure of my hands, okay?
Okay.
And I'll try to be as gentle as possible. I'm sorry. So you can tell me, does it hurt more when I'm pressing?
Yes.
Or when I let go?
When you're pressing down.
Okay, only when I'm pressing. Okay. Thank you very much. I'll get you covered back up, okay?
Do not skip the musculoskeletal or neurologic exam because the patient cannot stand or walk. No part of the physical exam involves the patient standing or walking besides assessment of gait and the Romberg sign. Everything else can be done with the patient laying down. If you need tips on how to do these exams on a supine patient, please call your facilitator.
Next thing, Mr. Tran, that I'd like to do is test the strength in your legs, okay? So I'm going to sit you back up, and then we can work on that, okay? I'm going to expose your legs, but I'll keep the rest of you covered, okay?
Okay.
All right, now the first thing I want you to do is lift your leg up off the bed, okay, to me. As much as you can. There you go. Keep it up, keep it up. Same thing with the other leg there, okay? Lift it straight up off the bed. Excellent. The next thing I'm going to do is bend your leg, and I want you to kick out against me, okay? Just like that. And now pull me towards you, and we'll do the same thing with the other leg, okay? I want you to kick out against me and pull me towards you. Okay. And the next thing I'm going to do is test the strength of your ankles, okay? I want you to point your toes up towards your head, just like that. Keep them pointed. Thank you. And now push both your feet down. Excellent. Okay, Mr. Tran, the next thing I'd like to do is check some of the reflexes in your legs, okay?
Okay.
All right, so all you need to do is relax, all right?
I'm really tired. Can I lie down for this?
Of course. Make sure to keep you covered as well, okay? Still comfortable?
Mm-hmm.
All right, I'm going to continue checking your reflexes, okay? So I checked your right, so I'll check your left leg now, okay? I'm just going to have you roll your leg and sort of bend it that way. Keep everything relaxed, all right? And I'm going to do the same thing with your Achilles reflexes, or doing the same thing with my hammer on the back of your leg, okay? So I just want you to relax. Let me have all of the weight of your leg here. Just a little tap. And the same thing over here, okay? Just relax. Thank you very much.
You must uncover and fully examine the part of the body related to the patient's chief complaint. If the patient is hesitant, please explain to them why you're performing the exam before doing so. If you don't feel comfortable, call your facilitator. If they refuse any part of the exam, document it.
All right, Mr. Tran, the next thing I'd like to do is actually take a look at that wound on your right arm, okay? I'll start by just unwrapping it, and then I'll take a look at it.
My arm really hurts. Can we skip this part?
I know it's painful, Mr. Tran, but it's something since it's related to your chief complaint, the reason that you came in today. It's something that's actually really important to your physical exam, so I'd really appreciate it if you let me take a look at your arm. Don't worry, I'll go very slowly. I'll be as careful as I can be, okay?
It is important that you perform a complete physical exam. If you run out of time, it is acceptable to perform a focused exam, meaning that you would perform the parts of the exam that are pertinent to the patient's chief complaint. Document any reasons for missing parts of the exam. Lastly, end your encounter by thanking your patient for their time and participation.
All right, Mr. Tran, so that's everything that I need to do today with you. Thank you very much for your time and your participation. I really appreciate you helping me learn how to take a medical history and perform a physical exam. So I hope you feel better soon, okay? Thank you.
Now let's review some tips you can use during your BCS sessions. If the patient has any questions or needs something during your encounter, look for their nurse, push the call light in the patient's room, or call your group facilitator. If a consultant, other student, nurse, or doctor comes into the patient's room while you're in there, stay. You can gain valuable information from them. If they ask the patient a question you were planning to ask, use the answer the patient gives to them. Try not to repeat the same questions. Same goes for exams. For example, if the surgical resident uncovers the infected leg you are about to examine, this is your time to examine the leg too. Just ask. If you're in the emergency room and your patient leaves for a test, please ask the technician where they are going. Most tests only take 10 to 15 minutes to perform. If they are taken to a stress test, MRI, or procedure, this will last longer than 15 minutes and you'll likely need to end the encounter. If they have a test done in the room, you can stay in the room and watch the test or wait right outside. Many of these tests are again done in 15 minutes. Interruptions of 10 to 15 minutes are acceptable. You can call your preceptor and let them know about the interruption and you will be given more time. On the general medical floor, if your patient leaves for a test, you will likely need to immediately end the encounter. Call your preceptor immediately as well. If your patient ends the encounter for any reason, again, call your preceptor. Remember, your HPI and review systems are all subjective. They are based on what the patient tells you. Your physical exam, assessment, and plan are all objective, and these are based on what you find and what you think. After each BCS session, you will submit your written H&P on Blackboard within 3 days. About 10 days after your BCS session, you should review the grading rubric and edited H&Ps prior to your next BCS session. The BCS component on Blackboard will be housed under the M2 longitudinal course. Student performance is evaluated using a 34-point grading rubric. This can be found in detail on the student performance evaluation on your handouts in Entrada. Each point in the 34-point grading rubric is given a score of either 0 or 1. A 0 is considered unsatisfactory, meaning that the behavior is absent or significant improvement is needed. A score of 1 is considered satisfactory, meaning the behavior is present and demonstrated in a well-organized way with little or no improvement needed. I will now review each of the 34 items on which you were graded. You can find the grading rubric and further details on each of these items in the BCS Student Performance Review. Both of these items are available in Entrada. Number 1, students will need to come prepared for each session, meaning you will have to bring all the required equipment. A full list of this equipment is available in the Student Orientation Guide as well as the syllabus. Some of the equipment required is available for checkout at the General Education Resources department in the Academic Center. Number 2, come dressed in professional attire and introduce yourself appropriately. Number 3, you will be graded on your interviewing skills. You should elicit the history from the patient, starting with open-ended questions, and use follow-up directed questions to clarify. Number 4, you should always be respectful of the patient and family. You should maintain the patient's modesty and privacy, and you should demonstrate respect for colleagues in the small group discussions. Number 5, you should be able to perform the physical exam in a manner that's appropriate for a second-year medical student. If you need any help, please don't hesitate to ask your facilitator. Items 6 through 9 pertain to your oral presentation. Number 6 grades the clarity and organization of your oral presentation. So you should be using the correct and logical order. You should describe the physical exam in a head-to-toe order, and you should be correctly using subjective and objective terminology. Number 7 is regarding the use of pertinent information. You want to focus your oral presentation on history and physical exam findings that are pertinent to the patient's chief complaint. Number 8, the oral presentation should provide an assessment of the patient's chief complaint. The students will propose a differential diagnosis and explain why they think the various differentials are more or less likely. Depending on your level of training, you may need help formulating a differential diagnosis. During the 15 minutes you have to formulate your oral presentation, you can also use this time to look up a plan or differential diagnoses on the internet, and even use your facilitator as a resource. Number 9, give your plan for working up the patient's chief complaint. You must state a diagnostic, therapeutic, and patient education plan and the reasons for making these recommendations. The rest of the items in the grading rubric will pertain to the written H&P that you will submit on Blackboard. Number 10, clearly state your chief complaint. Number 9, you should include a statement of the source of the history as well as their reliability. Please note any factors that may confound the reliability of the historian. Number 12, your HPI should be logically organized in a narrative form. So begin with an introductory sentence that includes the patient's age, gender, medical history, and their chief complaint, and specify for how long they've had this complaint. The reader should be able to understand the chronology of the patient's presentation. You should also include the presence and absence of symptoms to support and refute possible differential diagnoses. Remember to stay in the subjective, so you should use the correct terminology in this part of the history. Objective data is not listed in the HPI. Your HPI should thoroughly characterize your patient's symptoms using the OPPQRST acronym. The HPI should include pertinent positives and negatives found in the patient's past medical history, past surgical history, social history, and review of systems. Number 16, lastly, the HPI should end with a statement informing the reader of the patient's understanding of their illness. This will help the audience to determine an appropriate education plan for the patient. Number 17 should address the patient's past medical and surgical histories. These both need to be in a list format with dates and in order of severity or chronology. Family history, list at least all the first-degree relatives and their history, or if they're healthy. And other relatives should also be listed if they have history significant to the HPI. Social history, again, you must ask about alcohol, tobacco, and drugs. Do not include a sexual history if it's not pertinent to the HPI. Number 20 is the medication list. Remember to put it in a list format with the name of the medication, the dose, the route, and the regimen. 21 addresses the patient's allergies and previous adverse reactions. Again, we'll put this in a list format and remember to include the type of reaction the patient's had. 22 grades the review of systems. Remember that it should be complete. Again, in a list format organized from head to toe by organ system. Start with your pertinent positives and then include the negatives for each organ system. The next 3 items will grade the physical examination. So the physical exam needs to be complete. If any of the exam is deferred, please note these reasons. 24, use objective Descriptions to describe physical exam findings. Do not use the word normal. And then number 25, again, the exam should be in a list format, organized by organ system, starting with vital signs and general appearance, and then head to toe. The problem list should be organized from the highest to lowest priority, with the patient's chief complaint listed as number 1. You should include all the problems that you've identified in the review of systems, physical exam, and all active problems in the patient's past medical, past surgical histories, social history, and then preventative medicine. Items 27 through 31 will grade the assessment section of the H&P. All faculty will know that you may not have covered the organ system related to your patient's chief complaint. You will be using the IDEA method to develop your patient's assessment. You can see the description of the acronym here. The I in IDEA refers to the interpretive summary. So this is the summary that references the patient's history and exam findings that were presented earlier in the H&P that the student believes are pertinent to the differential diagnoses being considered. 28. D refers to differential diagnosis. You will propose and define at least 3 differentials and link them to information already presented in the history and physical exam sections. 29. E in IDEA refers to explaining which differential diagnosis is most likely and why. A is for alternative diagnoses. You will rank and define alternative diagnoses and explain the reasons for their prioritization. 31. The assessment section will also include a brief assessment for each of the problems in the patient's problem list. You will only need to use the IDEA method for patient's chief complaint. The last 3 items on the grading rubric assess the plan section of the H&P. 32. Propose a diagnostic plan. What tests will you order to work up the patient's chief complaint and why? 33. Devise a therapeutic plan. What treatments will you order and why? 34. Identify a patient education plan based on their needs. Now let's discuss some problems that may occur during your BCS sessions and how to troubleshoot these. Not enough patients. In the rare instance that there are not enough patients, students may be asked to partner up. Patient dropout. There are many reasons why encounters end. A patient may ask to terminate the session. Patients may go to a test. There may be long patient interruptions, and a patient might have a change in their mental status. Depending on how much of your H&P has been completed, students may still be able to complete an assessment and plan. If not enough information was obtained, students will be given another patient and start where they left off. If there is poor student performance or professionalism issues, disciplinary action and remediation will be at my discretion. So exposures to bodily fluids and infectious agents are always an issue when you're working in the healthcare field. Always check signs outside patients' rooms for contact precautions and make sure you follow these. If you have an exposure, this includes a needle stick, a splash of bodily fluid into an open cut or your eyes, exposure to meningitis or varicella without an appropriate respirator, please stop the patient interview immediately. If there was exposure with a splash or needle stick, please wash the site with soap and water and immediately contact your preceptor. I want to give a special thanks to the people that helped me with this video. That would be Rahul Patwari, Derek Norton, and Patrick Tran. Thank you so much. And most importantly, please have fun. This course is meant to be, above all things, fun.